Can your elderly loved one that resides in a nursing home be safely prescribed controlled medications or narcotics? If you are a skilled nursing facility staff member or long-term care staff member, what's your answer as well? So, what's your answer? My answer is yes. What I will say is there are multiple things that have to be considered when narcotics are prescribed. This is not something that any of us are doing lightly when we're prescribing these medications, right? I know that we've seen series, documentaries, and things like that about the opioid epidemic and how it's affecting people. So these are medications that we do not take lightly when we're prescribing, right? There are some things that steps that should be taken that should take place before these medications are prescribed, right? Care should always be individualized. So we need to be considering a multitude of things, right? Is the person a fall risk? Drug interactions, right? Does this person have a history of substance abuse in their past? Do they have a history of depression, anxiety? A scenario where there's uncontrolled mood concerns that could result in, inappropriate use or response to controlled medications, right? So, of course, we, for chronic pain, are not going to go from 0 to 100. Even with acute pain, right? It's not always 0 to 100. In this setting, we would, of course, try to do like over-the-counter medications first. That could be Tylenol, topical agents, BioFreeze, Voltaren gels, icy hots, Aspercreme, things like that, right? Side note, we often do not prescribe ibuprofen or NSAIDs in the long-term care space because of the risk of GI bleed and kidney injury. Okay, so back to the topic at hand. So we try over the counters. Of course, imaging can come into place depending on what's bothering them. Is it a joint, etc. We might image just to have documentation showing us what's the problem is, right? From that imaging, do we need to refer someone to a specialist? Because if it's arthritis, it's a joint, sometimes you can go out to specialty and they can consider if injections would be an option, surgery, that sort of thing, right? We can also refer to physical therapy, occupational therapy, as a means for pain modalities, right? There's several things that we can try before we get to narcotics. What you will often run into with long-term care patients is, right, they are of age, they've lived life, they may have gone through all these things. And so if we have them documented, then we got to figure out what's the next step. Sometimes when we're prescribing a patient narcotics, maybe the best bet would be for them to see a pain management specialist to address their pain more appropriately and safely, right? In this setting, medications are controlled, nurses administered, they are secured. So there's that aspect of it as well.